Dear members of White Army, welcome to the career counseling session. In the continuity series, we have today a special session about psychiatry residency in NIMHANS. Yes, definitely the #1 institution in India, and everyone looks forward to study psychiatry or other neurology or neurosurgery in the most premier institute of our country, that is NIMHANS. So let's know the experience of how the residency would be, what are the pros and cons, everything by the one who did the residency there in NIMHANS, my own beloved junior, Dr.Harshitha, who did her MBBS from the Bangalore Medical College and went on to do MD Psychiatry from NIMHANS. And further, she has done postdoctoral fellowship in community psychiatry. Welcome to you, Dr. Harshitha. I'm really proud of you. Okay.
Thank you, sir. Thank you so much for such lovely introduction. So you've always been a good senior, guiding senior for us, and your your work through White Army. It has been very helpful for the MBBS students. Thank you. Thank you for the introduction.
Harshitha, there are so many students out there who aspire to be like you, taking up psychiatry. So, but no proper guidance available. Okay, everyone will not get a good senior like you to guide or mentor them. So, through this video, I want a uniform like mentoring system out there for all the aspirants. So, I thought you are the best, better one to guide them. So, like, why everyone aspire to learn in NIMHANS? What's so special about NIMHANS, Dr. Harshitha?
Yes. So, as you all know that psychiatry, when it comes, NIMHANS is the premier institute. One is mainly because of the specialities it offers. So, you name the specialty for psychiatry, it is there in NIMHANS. So, and first of all, NIMHANS was started as an All India Institute of Mental Health. So, it started as mainly a mental health setup. Then neurosurgery, neuroscience, other neuroscience branches came up in order to reduce the stigma and attract the patients. So being a premier institute and have various subspecialties, people vouch for NIMHANS to learn here.
So what's the strategy like? What's now? Earlier there was separate entrance exam for NIMHANS particularly, but nowadays it comes under INISET. So what's the eligibility criteria to get into NIMHANS psychiatry, and what's the entry process like?
Yeah. So now initially it used to be yearly once exam. Now it has become bi-yearly. One is in June session and one is January session. So around 40 seats are there. Okay. It will be divided into 20 seats, and if a June session all the seats are not filled up, then it will be carried over to December or the January session, but the same will not continue for the next year. So and one more important thing is that Karnataka candidates will have reservation, and also Northeast candidates will have reservation. Around 4 seats will be reserved for Karnataka and Northeast candidates.
4 out of 20.
Yeah.
And how much for Northeast?
Northeast also around 3 to 4 seats will be reserved for them.
Okay. And 12 in other remaining 12, is there any particular quota or defense?
Yes, unreserved and OBC and SC/ST, that will be as per INA rules.
Okay.
So the entrance will be same, like the common preparation for all the INA exams. But one thing is that people who aspire psychiatry, it's important to get into the institute for the passion of the branch, rather than they are getting as the institute. So we see many people now, now the ranks, it's unpredictable. Like they don't know like which branch they are getting and which institute they are getting when
yes,
it is.
There are two types of students. Okay, one is they badly or they definitely want to do psychiatry only, and of course for psychiatry best is NIMHANS, so they will get into NIMHANS that way. Another is they want to learn in NIMHANS, so they didn't get other branches maybe, so they land up in psychiatry. and there like that. There are two kinds of people. I think mostly are like first category 1.
Yeah. So it's important to have a good interest in the branch. Otherwise, also, since our UG exposure on psychiatry is very
Limited.
poor and very limited, and not everybody will attend the posting. And the clinic, though people will have interest for the theory aspect, the clinical exposure is different, and clinics and psychiatry is a different ballgame. So it's if people are in a dilemma, they like a subject and they don't know whether to get into the branch or not, I would recommend them to do 2 or 4 weeks of observership in any psychiatric setup, so that they'll get to know how to deal with the patients and whether they really fit into the branch or not. So that's one thing. And as far as ranks are concerned, it will be the starting rank will be around hundreds to 180. The recent one who got in, the starting was around 180 INICT rank, and general category it will go up to 500 to 600. So if they have a reservation, then the higher ranks also can get into psychiatry. For example, the OBC up to 2000 and scheduled category even more. So that's the main strategy to get into.
For the entrance in the INSAT entrance exam, what will be the questions will be like? Will they be asked in depth of the psychiatry, or what are the important things to know for the exam?
See, INSAT entrance exam, it's a common entrance exam now for everybody. So it's like some part of it, like 10% to 10%, 5 to 10% only will be asked from the psychiatry. But initially, it used to have a NIMHANS separate psychiatry exam, one common paper, the one which I got it 5 years back. So it used to have a basic common paper for the neuroscience aspect and a separate psychiatry paper. Now it is a common entrance for all the institute of national importance. So specifically, they need not prepare for psychiatry as such. They have to prepare, they should have a general preparation.
So now there are two types, no? Even for psychiatry, I think there is 3-year course and a 5-year course.
No,
like neurology and neurosurgery.
No, there is only 3-year course for MD psychiatry. Initially, there used to be a DPM or Diploma in Psychiatric Medicine. Now it is completely MD psychiatry. It's a 3-year course. We also have DM courses in 3 specialized branches: that's Center of Addiction Medicine, Geriatric Psychiatry, and Child Psychiatry. Child Psychiatry is actually a separate department, just like neurology and neurosurgery. So
we have a separate entrance exam for that after MD?
Yes. They have a separate DM exams that also comes into INSAT.
So again, it's 3 years after same.
Yes, 3 years. 3 years same, just like DM in any medical branches. It is DM in psychiatric specialization.
Harshitha, now that I have somehow got into NIMHANS, okay, first year psychiatry resident, looking all around what's happening. Okay, in that ocean of patients, I'm lost, really lost. What to do? What should be my strategy in first year? And what should be my preparedness before entering in NIMHANS, like both physically and mentally, how I should be? And of course, in the second year and third year, what should be my study strategy, thesis? And most importantly, I heard that you residents are so much occupied with the patient workup, other things. When and where you will study? That's the biggest question. So,
see, I'll give the orientation about the first year, second year, and third year residency.
Oh, the time pattern, everything. Okay.
Yes, in NIMHANS. See, the NIMHANS curriculum is very well built up and it's revised and revamped always. So it's very standardized. In a sense, the first 6 months invariably for all the residents will be posted to adult psychiatry unit. So the concept being, in the first 6 months when you get into the adult psychiatry, you will be taught the clinical skills, ethics, and the basic interview. Psychiatry is a branch where we deal with people's emotions and also personal things, where the interview skills will be taught well. The basics will be taught well in the first 6 months, and that I feel is very crucial for the next the upcoming course. And after 6 months, you will be posted into the various vibrant specialities of psychiatry specialities. So we have peripherals postings like child psychiatry, addiction medicine, and geriatric psychiatry, therapy, psychotherapy. The importance of NIMHANS as compared to the other central institutes for the psychiatry is its core psychotherapy training. We will be supervised, or we will have a supervision for psychotherapy. Various schools of psychotherapy will be taught and will be supervised for 3 years, and we will have a module at the end, the examination, the exit exams for psychotherapy at the end, and also the neuromodulation. The second important thing is that in NIMHANS is that neuromodulation technique, which is a upcoming branch and which is very hopeful. Apart from ECT, we have DMAS, that is transcranial magnetic stimulation, direct current stimulation, vagus nerve stimulations. All this, there is a huge research that is going on with Center of Neuromodulation Techniques. And along with NIMHANS, there is 3 other institutes that are stacked up with the NIMHANS. CIP Ranchi and Manipal institutes, along with NIMHANS, and also the Vellore has been tagged up with the has been tagged up with NIMHANS, and it's a huge project. And also there is a fellowship courses in neuromodulation techniques, and also the other specialities like forensic psychiatry, community psychiatry, telemedicine. You'll be posted in neuropsychiatry, neurology. We will have 3 months of neurology postings for psychiatry residents, and also consultation license psychiatry or general hospital psychiatry, where you will be posted to St. John's. You'll be seeing cases from Rajiv Gandhi, Sanjay Gandhi on call basis. The another important thing in NIMHANS is about the beauty of forensic psychiatry. So psychiatry goes, psychiatry and law goes hand in hand, is what our psychiatric patients are more probability of getting into conflicts with law is more. And we see many legal issues. So psychiatry is only branch among all the medicine where we are abide by a Mental Health Care Act. So we follow the law and its rules, and everything right from OPD, inpatient, and emergency services, which is provided in NIMHANS, is abided by the Mental Health Care Act. We follow the standard operative procedures, SOPs, and also whatever the law says. So in that way, the training, the standards will be incorporated within the students in the training period itself, which will be helpful for them when they go out. So as I was telling about this, initially the first 6 months you will be taught the basic skills, the psychopathology and the basic interview techniques. Then you will be posted into various peripheral postings. When you come back in the last 6 months to the adult psychiatry, you should be well versed with all your peripheral posting knowledge, peripheral skills, so that you can plan well the management of the patients in the last 6 months. When you do well with your first 6 months and the peripheral postings skills, automatically the last 6 months will become very easy flow for you. You will enjoy the last 6 months in planning your own management and treating the patients. That's how it is. And when it comes to thesis, good thing in psychiatry department is that students will be given the choice to work on their areas of research interest. They will be given the options, like the first, second, third options, where they want to work, and the appropriate guides will be allotted to them. And so in that way, the research will be more interesting for the students as well. And when it comes to research, psychiatry is the one which have a maximum number of projects and maximum number of research and NIMHANS. And the students who are really interested in research and mental health, NIMHANS is the go-to institute, I would say. So that is the main.
And the guides are also, so like I think concerned and cooperative regarding to the thesis and all. You have very good, passionate teachers who are
Yes.
who will guide you not only to do thesis but also to publish so many publications or research papers in various national and international journals also, because their names also carries a lot of credibility, and editor will not have any second thought before publishing such articles if it is from NIMHANS or from a teacher of NIMHANS. So that's the extra added value you have being a NIMHANS resident. What about the study? What is your duty timing will be like, morning till evening?
So it's always 8 to 8. 8 a.m. you have to start, and officially it is 8 to 8 a.m. to 8 p.m. If the resident, it depends, again, it depends upon the postings. If the resident finishes the work early, then they can leave. It's nobody compels them to stay in the ward. But they have to be on call for their patient. And one more important thing I have to say, which is different from the other medical colleges, is that there's no hierarchy in NIMHANS. So the first year, the second year, and the third year will have their own cases, own number of cases, and they are accountable for their cases.
Great.
So it's not like the medical colleges where we see the final year exam going students will not have any cases, and those cases will be displaced to the first and second year. So the good part in this is that the burnout will be reduced.
Yes.
The burden and burnout on the residents will be
secondly,
reduced.
from the admission till the discharge, you will be managing.
Yes.
So you know the entire protocol.
So the entire thing, so that continuity of the care of the patient will also be good. And these three residents, the first year, second year, and third year JRs, junior residents, will be accountable for the senior resident. So they will be supervised by one senior resident and interned by the faculty. So so that tree is good, so that it will help in a good patient care, as well as the burden on the individual students will be less. Sorry?
Night duties?
Night duties. Yeah, when it comes to duties in adult psychiatry unit, there will be around 10 to 12 residents posted at a time in one unit. So they will have in one month, in a 3-month posting, the rotation will be every 3 months. Not every month. It will be we have 6 adult psychiatry units, and each unit specializes in different things. So, for example, schizophrenia, one unit will be specializing in perinatal mental health. One will be in the OCD, obsessive compulsive disorder. One unit will be specialized in NIBS, that is non-invasive brain stimulation, forensic psychiatry, and telemedicine. So one will be specializing in neuropsychiatry. So each unit will be specializing in different units, and you will
every 3 months posting.
Yeah, in every 3 months there will be a rotation, and every junior resident will be getting in 3 months posting maximum of 3 duties. And this 3 duty will be 24 hours. If you start in 8 a.m. in the emergency psychiatry triage area, or we call it a short stay ward, you will be ending next day 8 a.m. and you will be supervised by one senior resident. And 2 other residents will be doing the ward side
monthly once. Monthly once.
Yeah, it's almost like monthly once duties. So as a senior resident, each unit senior resident may have 3 to 4 senior residents, so they will have more number of duties, but junior residents will have monthly 1 duties. But senior residents will be on call, but junior residents will be there in the short stay ward.
So the most common emergencies you get as?
So we have emergency beds around 14-15, and the turnover rate will be 30 to 40 patients per 24 hours.
Okay. What are the most common emergency cases?
Most common emergency cases, most of them will be aggressive patients who have acute psychosis. They can be de-addiction cases. Many de-addiction cases we get, like alcohol withdrawal or opioid use, or it can be the cases like delirium due to multiple causes, like medical causes, where we have to rule out the medical issues and then treat.
Like in neurology here also, do you have a per day only 100 cases or anything like that, restrictions? For in OPD or in admission?
Yes, in OPD we have a cap, as in up till 130 they will be taking the cases. After that, they will be closing. But OPD runs till 3 o'clock to 4 o'clock, depending upon. So the more, usually on an average, each OPD we will have in the screening OPD, as in the first contact OPD, we will be having around 80 to 100 new cases. And we will also, along with that, in the same OPD, screening OPD, we will be calling for the detailed evaluation. Around 10 to 20 detailed evaluation we will be giving for the junior residents. And in the follow-up OPD, we will have around 250 to 350 follow-up cases per OPD. So this is the
study after like 8 o'clock, you can go back and
yes, after 8 o'clock, you can go back and do your studies, and the studies will happen mostly in the tight academic schedules and the rounds itself. It's like the clinics only, the students
most
start
of the
picking up and studying.
Correct.
So academics is one good thing. It's very well designed. And for me, as personally to say that I felt in my PG, it was more hand-holded than my UG. I did my UG in BMC, and we only the seniors used to guide us how to study, but no much supervision by the faculty. But here it is like the academics are very much tight, and each faculty will attend academics invariably. All the faculties will attend. So we will have a weekly seminars. We will have weekly journal clubs and bi-weekly case conferences at departmental level. And at unit level, each unit will have its own case conference, its own problem-based discussions, and its own topic presentation. So students end up learning in the units itself, case-by-case learning.
You have interdepartmental like sessions also?
Yes, we had interdepartmental sessions, as in with neurology and neurosurgery too. But with addiction, psychiatry, and with child psychiatry, yes.
But Harshitha, only one like a disadvantage what I feel is you don't have referral from other departments.
Yes. So I was also coming for the limitation of that. See, NIMHANS is being the Neuroscience Institute, general hospital psychiatry exposure is less. That is one limitation.
They're posted anywhere, something like you told.
Yes, St. John's, they will be posted for 3 months. So there you will get general hospital psychiatry exposure. But it's important to learn psychiatry in a non-psychiatry setup.
Exactly.
Yeah.
Because there will be a patient with psychiatric
medical disorders, and screening the psychiatric illness in the medical disorder is important. So this also been
very common. Pancreatitis with alcohol withdrawal.
Exactly. Exactly. So the legendary psychiatrist called Norman Sartorius mentions this. It's always important to teach psychiatry, learn psychiatry in the general hospital setup, in the non-psychiatry setup, so that when you screen and you start reading the general hospital cases with for mental disorders, the morbidity of the illness comes down. That's important. So, but then I think the 3 months exposure in the general hospital setup will give that a clinical acumen for the students. They will not lose much, is what I think.
How do you manage the stress, Harshitha? I think I have seen myself internship experience at BMC, which is also again high volume center. BMC wards always filled, OPDs also. A lot of variety of cases every day. Used to see as an intern, I'll be seeing the patient first, so they'll be keep on talking. You should be listening, or whatever they say. You can't interrupt them. They'll get agitated and also. I think, how is the work environment? Is it stressful, or how is it? You have any like apprehensions while dealing with the patient? I have seen some of my seniors, those who gone to measure the blood pressure of a patient, got scratched by the nails, and after that in BMC wards it was stopped measuring blood pressures. So how is the work environment would be like? What is the level of stress you will have? Because all the close diagnosis they will have. Most of the diagnosis will be very close. So when you're managing a patient, how difficult it is or how easy it is?
Yeah. See, the patients will be, there are various types of patients that we deal with. The support system in NIMHANS is very good. As in, the first thing is that you will be taught the first 6 months, which I told, the skills to manage the psychiatric patients, you will be taught how to manage and how to safeguard yourself in psychiatric wards. And also the disciplines that we have, the multi-disciplines, every rounds, each patient will be seen by a psychiatrist, the psychologist, and the social work team. So this and the psychiatric nurses. So this multiple disciplines will help to will reduce the burden on just the psychiatry students, which is not seen in other colleges, other medical colleges. And our work will be well divided. What the psychiatry resident is supposed to do, what the psychology student is supposed to do, and what the social work team is supposed to do. So the plan of management also will be well divided, so that the stress on only psychiatry resident will be less.
You also have, I think there are courses like MSc, MPhil, and so many others. There are already, you told 20 plus special, like subspecialties. So you feel some competition or what to say, from other fields or other like competitors in your field, or when you're doing residency, you feel you are missing out that part?
No.
Like you already told that there is some psychologist is there. So yes, in the psychiatry, the best part is counseling the yes, patient. So you are missing out that part now as a psychiatrist.
No, not exactly, because the psychiatry resident will be having a separate therapy posting. So the beauty of psychiatry teaching in NIMHANS is that they will be posted to rehabilitation psychiatry. They will be posted to psychology postings like therapy postings, and they will have a separate psychology classes also, so that they will be learning all those areas, and so that apart from the pharmacological treatment, so that when they go out of NIMHANS, they should be equipped with all the skills to manage the patient. Right. Because here we have all disciplines, but when you go out and start practicing, you should be equipped with all the skills, and the training will be providing us with all the skills.
What are the newer modalities you told? What are the interventions you have as a psychiatrist now? Do you have any interventions to do, like deep brain stimulation, something? I don't know, but do you have any kind of stimulation, any interventions in your field?
So as I told, the neuromodulation technique in psychiatry is booming, and electroconvulsive therapy is one. ECT, the modified ECT. Initially, they used to give unmodified ECT with that ages back, but now the modified ECT, which is a very brief period, and it's a daycare treatment. Now, along with that, there is the transcranial magnetic stimulation, which are now FDA approved for depression. And we also have direct current stimulation, the TDCS we call, and also the vagus nerve stimulation. And now the research is happening about the deep TMS, that is deep transcranial magnetic stimulation for OCD and other disorders. So these are it's a separate branch in NIMHANS. There is a fellowship for this neuromodulation technique also.
As a resident, you get to do all this, or only technician does and you just interpret?
No, we do. There is no technicians as such. So all this treatment will be administered by the residents under the supervision of the fellow.
Okay. So what after residency, Dr. Harshitha? You told, like you said, there is a DM or postdoctoral fellowships, or you can directly practice also. So many, you can go abroad, or you can directly go into pure research. So multiple options available.
Yes. So the options are huge, as you told, because after MD, there are, as I told, all the adult psychiatry, the entire 6 units as the fellowships. So many fellowships are there, around 9 adult fellowships, along with the 3 subspecialties like addiction, child psychiatry, and geriatric psychiatry. DM courses and fellowship courses are there. Along with that, if you want to get into a pure research field, you have PhD neurosciences. And if you are planning to go abroad, our faculties have good network with the foreign universities. We have visiting faculties from the foreign university, Yale's University, University of British Columbia, and King's College London, and Australian universities. We have visiting, and we have good collaboration with them. So if it comes to US, you have to clear your NLE steps. But with Canada, you will be able to do research fellowship there. And with UK invites students from NIMHANS without clearing MRC Psych itself. It will invite for the fellowship. And then once you get into the fellowship there, clinical fellowship, you can clear your MRC Psych and get into the residency. And Australia, you will have to clear an entrance exam called RANZIPS. After that, you can get into the residency. But the CV of NIMHANS will be so vibrant that the institutes will accept easily. And I have seen many people, like people who have done MD psychiatry elsewhere, they just come to NIMHANS for 1 year residency or fellowship just to launch out to other countries. So this is about outside, abroad opportunities and research opportunities. When it comes to within India, there are many peripheral aims that has been the national institutes peripheral aims that has been opened, and I have seen my own seniors who have gone into these aims, different aims, and then establishing the department and developing the department. They have attracted many the projects from WHO, NIMH, and the ICMR projects, and they are really doing well with the department. Otherwise, if it's a private practice, that is also good. I have seen people who are passing out from here and doing good private practice. There are a group of psychiatrists who have formed their private setup. I mean, the psychiatry setups in Bangalore and elsewhere, other cities, and they are practicing pretty well. And one other good thing is that this online consultations, which is easier in psychiatry than compared to other medical branches. So especially the pandemic.
Follow-ups is very convenient through online consultations.
Yes, online therapy consultation or normal psychiatric consultation, because general physical examination is not much. We do collaborate with the physician to get the general physical examination done, but most of the consultation, telepsychiatry is the feasible option. We have a telepsychiatry department itself, and there is a recent telepsychiatry operation guidelines that has been framed by NIMHANS with collaboration with Government of India, and that itself will help in good practice.
You are the policy makers. Whatever it's in India, whatever related to mental health, that will directly, or any protocols or any new directions, anything, it will be made from or made by the NIMHANSonians or from NIMHANS only. That's you're the authority in the field, and great to listen to you. And I also like getting tempted to get into psychiatry. Like I always loved psychiatry. I always encourage my patients, because as we know, 75% of the cases what we see in our day-to-day practice is psychological, more than what they have any real organic pathology. What they need is just some psychiatric evaluation and proper counseling also. So I always encourage my patients, please go get in touch with a good psychiatrist and get properly evaluated. And we also know that 1 in 3 people is psychiatrically affected one or the other way. So it's very important to keep our mental health under control. And to get the expert opinion at the earliest, and to have a good, peaceful mental health. So, as a very responsible senior, and also now you are a psychiatry consultant as well, what's your concluding remarks and advice to your upcoming juniors or aspirants?
The mental health is kind of neglected. Gone are the days where there was stigma to the psychiatric illnesses, but there was so much of knowledge spreading. I see many patients seeing the newspaper, coming actively, give us the various neuromodulation technique, therapy, counseling. Instead of they directly come to us saying all this. It's been very well published now, very well publicized. So gone are the days where the stigma was rampant. So it's important to have a passion for the branch before getting into the psychiatry, and then the good orientation. Once you get into the field, you will enjoy the field, is what I say.
I am wondering whether the incidence of psychiatric ailments are going up, or because of the increased awareness, patients are coming to the setup. How is the because of loss of work stress, or the family commotions, all those things, I feel the incidence wise there's increase, or like you said, by the so many media, other things, awareness being increased, and that's how patients are taking your help. How is it?
Sir, it's the psychiatric illness were always prevalent, but the people there are so many factors that that was a barrier for them to seek treatment. Now that that stigma has come down, the approach for the seeking help has increased, and also there are evolution of new types of psychiatric disorder with the increased digital use. So the illness is also evolving. The many various types of disorders we are seeing with the use of digital technology, like misuse of it.
Pediatric age group, yeah.
Yeah, misuse of it. But because of the awareness, seeking treatment has improved is what we are seeing.
Finally, you feel after a few years of practice, do you feel burnt out or some monotonous, or how it's like? Because every day you have to, unlike other specialties where you just do 5 minutes examination or this thing, even a surgery, it's a 1 hour job, finished, go get rid of the patient, that's it. But psychiatry is not like that. You have to deal with the patient for hours together, for years together. One bipolar patient, he'll be keep coming for years together, and meanwhile he'll be keep calling you also for these small things. So should have a lot of patience. Lot of patience means more than a mother. Okay, so to be frank, do you feel burnt out after a few years of practice, or you have some other ways of to come out of that? How is it?
I think I have not gone to that level.
Yeah, that's right. But you might have seen your professors or seniors,
yes.
or
not necessarily, because over the time their resilience also would have increased, and then as you told, there is the chronic patients which who do keep coming and seeing the same the faculty, but the trust level for the faculty will also be built in that patient, and it's like if you are a physician, if you are a surgeon, you are treating the patient only. If you are a psychiatrist, you will be treating the whole family. So the whole family approaches and trust, the amount of trust they have, that itself is a motivation for them.
That's great. Very well said, Harshitha. See how to take everything positively and look into the only very optimistically. That's how. See, that when you are very passionate about a branch or your field, only then these kind of words comes out. Okay, other if you're really working mechanically or for the sake of doing a PG or working for an institute, these things will not come at all. So once again, I feel really privileged to be interviewing you, such a intelligent and genius student. Harshitha, I know you very well. And I wish you all the success and a bright future ahead. Help those who are already in need, and also train your juniors and other psychiatry aspirants to the success, and bring good laurels to the Mother Institute and also our country. Okay, that's what I can wish and pray for my lovely junior out there. Thank you so much, Dr. Harshitha, for your valuable time and kind words of experience. I hope this will help thousands of psychiatry aspirants, not only help, but motivate to take up this branch, a beautiful branch, I should say, of psychiatry, and do better and better in the field. come up with some revolutionary ideas, and see already so many interventions are coming up. So a lot of transformation happening, even the patient wise also, that the stigma, everything gone now, and patients also openly accepting the things, and they want to come out of it. Similarly, for consultants also, it's not just counseling all alone in this field. On a lot of interventions, and so many newer ideas are coming up. So both are benefited, both the patient as well as the psychiatrist. So wonderful branch to pursue, I feel. And you have I think, very good balance of personal and professional life here.
Yes.
Okay, you have time for less of emergencies, which can be tackled by junior staff as well. So you have a time for personal life as well, and a very good quality time for professionalism as well. So hope you second me with these, Dr. Harshitha. Anything?
One more thing I want to tell is that with my personal experience, what I felt is that the psychiatry will not only teach you the subject, it also teach you life skills to be a better human, and also to build a better relationship in your personal life, to be a better parent. We see a lot of parenting issues, and to be a better parent and to be a better spouse, to be a better person in the society.